welcome to Farm Ato Studios, and I am Farm Charles Ato Aqua Jr., and I am a pharmacist by profession. Now, this show on YouTube channel is called The Charles Show or The Charlie Show, and it's grouped into two segments. We have the lifestyle segment and we have the health segment. The lifestyle segment is called the Inside Life program, and the health program is also called the Health Life program. Now, this segment is the Health Life program, and I am here to talk about antibiotic resistance. Now, this program is going to be very educative, very entertaining, and you are going to be flooded with so much information when it comes to drugs. Now, when it comes to conditions, when it comes to diseases, I will invite my colleague doctors who will come on this show and they will educate us on certain kind of conditions that we always, we've heard of it, but we don't know about it. Example, tuberculosis, pneumonia. All these are infections, they are conditions that we have heard of it, but we need to know the causative organism causing it and how to prevent ourselves from getting certain conditions like hypertension. Now, since I am a youth and I'm young, I would want to talk about hypertension. I want to talk about diabetes. I'm going to talk about cholesterol, hyperlipidemia. I'm going to talk about so many conditions that we should have knowledge about so that we can avoid it in future. All right. So this segment, I'm going to talk about antibiotic resistance. Now, antibiotics we have heard, it's not one drug. They are group of drugs. In fact, antibiotics it's a general name for so many drugs. All right. We have antivirals under it. We have antifungals under it. We have we have several drugs that are sub under antibiotics. Now, we want to talk about antibiotic resistance. Now, antibiotics are drugs that are supposed to inhibit the growth of either virus, bacteria, fungi. All right. Now, until you seek the counsel of your health professional, you wouldn't be able, as a layman without the knowledge, you wouldn't be able to choose the right antibiotic to use for the condition you are experiencing, because the manufacturer will write so many indications on a leaflet. Fine, it may be used for it, but it may not be appropriate for the condition you are experiencing at that moment, because you may be having other underlying conditions that could prevent the drug you are taking from working. That is the reason why you don't just go to the pharmacy and just buy an antibiotic just because you know it is used for maybe cough or it is used for UTI or something. Now, for instance, you are used to, this word, ekrubewu, so penicillin vein or something. I don't know if you've heard of this penicillin vein in town, everywhere, penicillin vein. Now, you are taking penicillin V at home because you think that, a crew will we and we sorry to, I don't know how to, pronounce, but we like in your stomach. And now you have another condition, which is cough. Now you go to the pharmacy, and because you know the indication of amoxicillin is used for cough, you can use amoxicillin for cough. You just go, and some of you are so impatient when it comes to counsel. And when you get to the pharmacy, it is very important to seek the counsel of a pharmacist before taking the medication. Looking at or finding information on Google shouldn't be your final, shouldn't be your final conclusion before taking an antibiotic. Now, with these two medications I have mentioned, you have taken penicillin V, which is for ekrubewu, no problem. That's what you believe in. Now you've come to the pharmacy, and because you know amoxicillin you've been told that it is used for cough, you come and buy it. But the pharmacist actually knows that it may not be good for you at that moment because they are of the same class. Penicillin V and amoxicillin are of the same class. I am not saying you can't take it together, but taking two medications of the same class increase the side effects that you experience. Now, amoxicillin has grown resistance in our time because a lot of people do not take their time to diagnose themselves before taking medications. So we end up misusing the drug because our friend or a family member has taken a certain drug for a certain condition. You think it is best to also take it. Please stop doing that. That is not the right way of taking antibiotics. Now, antibiotic resistance, it is about organisms that are found in the body gaining resistance or creating barriers around them to prevent antibiotics or to prevent, in fact, antimicrobials, antifungals, antimicrobials in general. So, antifungals, antiparasites, medications, all those medications from working because at the end of the day, the organism knows the ingredients or knows the drug. So they end up growing resistance, creating a barrier around them. And it comes about you abusing and misusing the drug. Antibiotic resistance is one of the main reasons why so many people die in the hospitals. Now, because when you are young, you take in antibiotics anytime, metronidazole. This is fragile. I don't know if you've heard of fragile before. You've been taking fragile because almost say fragile no a bois for if I'm saying a crew, and then you have certain things that you know about fragile, which it may not be appropriate, but because it works for someone, you end up buying it. Now you buy the fragile, that's fine, and you've been taking fragile every time. Now I have a story to tell. There was this lady that came to the pharmacy just last week, and she came to buy fragile or as flagel. That's the actual name for it, not fragile. It's flagel. In other words, the name is called metronidazole. Now, this person came to buy metronidazole, bought it, and I asked, "Why are you buying metronidazole? It's an antibiotic over the counter." Now, over the counter are drugs, over the counter are drugs, over the counter drugs are drugs that are given to patients without prescription. So she came to buy it without prescription, and I asked, why are you buying the metronidazole? And she said that her colleague, in fact, a friend of hers, has been taking it after her menses every time she's done with her menses because there's a belief that when she takes it, it clears off every, what's it called, infection that comes with the menses. And I told her that, so she said, next, how well do you know about antibiotic resistance? I had to educate her before she had to change her mind. And I told her the right ways to prevent herself from getting infections just after menses. We will talk about that. We will talk about that in the upcoming programs. Now, fast forward. Metronidazole and other products have been, as a you've been buying flagyl, metronidazole for some time with other antibiotics like ciprofloxacin and other medications for like every condition. When you know you have UTI and I'm just going to buy, ciprofloxacin. When ciprofloxacin doesn't work, then you can buy cefixime. You just be abusing the drugs anyhow. There will be a time that I'm not prophesying. I'm not saying it will happen. But what if you get sick at a particular time and these drugs don't work? So, there are so many people in the hospitals that have gained resistance to drugs at emergency point. When I say emergency point, at a time where they need the drug to work and they need it to survive or to regain their life. Hence, the doctors end up the doctors end up becoming so clueless on what to do to treat certain infections that come in the hospital. Some people come with cellulitis. Cellulitis is a condition. I'll talk about it later on into details. It's actually a condition or an infection that mostly happens around the legs. It can even happen at other parts of the body, but mostly the leg. And it's caused by Staphylococcus aureus. It can enter into your skin, and it's when it spreads, it can make your skin very, black. You talk about it, and it's very, very painful. Now, this patient was suffering from cellulitis. And not knowing this patient has been taking clindamycin for some time. The person has just been abusing clindamycin for some time. And this time she has gotten cellulitis. They gave clindamycin to treat the cellulitis or to reduce the spread of the infection. Hence, it wasn't working. Now the patient, the patient has to now be there suffering whilst the disease or the infection spreads, and the doctor or doctors who are also taking care of such patients become so clueless on what to do. So they end up amputating what? The patient. So please, antibiotic resistance is a topic, or is actually an awareness I'm creating, that when you do not take it serious, it may affect you and also limit, in fact, reduce your age or reduce your life on this earth. You wouldn't be able to live long. So, my quick advice, before you take in antibiotics, please go to every doctor or any doctor you see in any good facility, or go to a pharmacist at any community pharmacy here nearby and ask them for information relating to antibiotics that you want to take. And also, if you have an infection, please seek guidance before taking any antibiotic. All right, thank you so much for tuning into this channel. You have to wait for the next episode, part 2, about antibiotic resistance. And we have several topics ahead that we would want to talk about: contraceptive uh, issues when it comes to, birth control, when it comes to stomach ulcer, when it comes to malaria, when it comes to hypertension, diabetes, and when it comes to living a healthy life. Thank you so much for tuning to my channel, and I hope you've enjoyed the video. Please, I would want you to subscribe, I would want you to like and share, and also please and please comment. Your comments are very important. Thank you so much for joining this video. Thank you, thank you, thank you.